So let's talk briefly about the drinking context and outcomes. So the drinking context, where are people drinking? So we can purchase alcohol in an on-premise establishment like a bar or restaurant where we drink the alcohol in that context. We can also purchase alcohol in an off-premise establishment like a liquor store, a grocery store, etc., and we drink it somewhere else. So the drinking context could be a home, it could be a friend's house, it could be theoretically a public location. But when we talk about the drinking context, and we're talking about in the policies that we're going to talk about during this module, we're particularly concerned about these on-premise establishments where people essentially have to get home after drinking. Essentially, the alcohol purchased in an off-premise establishment, like a liquor store, is typically consumed in the home, so we don't really worry about it. But these on-premise establishments are both in the public, and then these public drinkers tend to drive or find other means to get home. So we want to modify this on-premise drinking establishment, whether it's the establishments themselves, through the servers, or the larger policy environment to impact alcohol consumption and then the consequences of that use. And again, we want to do so to reduce alcohol consumption and to reduce the negative consequences, and particularly what happens when people drink in these public locations and then return home. But the key question here is what should be measured? So if you're conducting a policy analysis or you're conducting an evaluation study to determine what policy to use or whether the policy or program that was implemented was really effective, you have to think of what outcome is most appropriate. Do you want to focus on alcohol use, which could be any alcohol use, the frequency of alcohol use, binge drinking? Do you want to focus on the consequences of use? And if you're focusing on the consequences, are you going to focus on the short-term consequences? So drunk driving prevalence or alcohol-related injuries or violence? Or are you looking at long-term consequences, which is more health-related in terms of alcohol dependence or chronic diseases like liver cirrhosis or cancer? So careful thought must be used when determining what outcome should be measured and how to actually measure that when evaluating the impact of the policies and programs we're going to discuss.